Stop scrolling for just 10 seconds. Because if you've been waking up at night, walking a little slower, or feeling tired in ways you can't explain, your body may already be whispering something important to you. Not loudly, not dramatically, quietly. And the danger is, most people ignore quiet warnings. Today, I want to talk to you like someone who truly cares about your future, not to scare you, not to overwhelm you, but to help you recognize what your body may already be trying to tell you, while there's still time to change the story. This is Health Wellness Secrets, and if you're over 40, feeling more tired than you used to, noticing swelling, stiffness, or shortness of breath, please stay with me. What you're about to hear could protect your independence, your quality of life, and possibly your heart. Let me start with something most people get wrong. They assume that serious heart problems arrive suddenly, a dramatic collapse, a sharp chest pain, an ambulance. But heart failure almost never starts that way. It creeps in slowly, quietly, over months, sometimes years. It disguises itself as getting older, as being out of shape, as just stress. And because it doesn't shout, it gets ignored. You keep living your life. You adjust, you slow down a little, you climb stairs more carefully, you rest more often, you tell yourself it's normal. But inside your body, something else is happening. Your heart is working harder just to keep up. And that extra effort comes at a cost. Let me tell you about Dorothy. She was 71, still driving, still active in her community, still helping with her grandkids. But little things started changing. She began waking up 2 or 3 times every night to use the bathroom. Her ankles looked swollen by evening. Climbing the stairs left her breathless. She mentioned it casually to her doctor and was told it was probably age, maybe her kidneys, so she accepted that answer. But when she finally came in for proper testing, we discovered the real cause. Her heart wasn't pumping efficiently anymore. Fluid was backing up into her legs and lungs. Her body had been sending signals for months. Once treatment started, the progression stopped. She kept her independence. She kept her life as she knew it, but only because she acted in time. And here's the hard truth. Many people don't. I want you to understand something important. Heart failure does not mean your heart suddenly stops. It means your heart slowly loses its ability to pump blood well enough to meet your body's needs. Unlike a heart attack, which strikes fast, heart failure builds gradually. Your body compensates beautifully at first. Your heart beats faster. Your blood vessels tighten. Your kidneys hold onto fluid to maintain pressure. You feel mostly okay. But beneath the surface, damage continues. And by the time symptoms feel serious, the heart is often already significantly weakened. That's what makes early heart failure so dangerous. Not what you feel, what you don't feel. Now let's talk about the signs your body uses to communicate this struggle. These aren't random. They're connected, and they often appear long before a crisis. First, many people notice their stamina fading. Activities that were easy 6 months ago now feel exhausting. Walking around the block leaves you winded. Simple chores drain your energy. That's not just aging. That's your heart struggling to meet physical demands. Then there's a racing or irregular heartbeat. You might feel fluttering in your chest while resting, a pounding sensation when you're trying to sleep. That's your heart pushing harder to compensate for weaker pumping. Next comes brain fog. You forget things, lose focus, feel mentally cloudy. Your brain needs a large share of your body's blood supply. When circulation drops, clarity fades. Family members often notice this before you do. Then appetite changes. You feel full quickly. Food doesn't appeal to you. Sometimes nausea sets in. Fluid begins backing up around your digestive organs, creating pressure and discomfort. You may lose muscle weight while gaining fluid weight, a dangerous combination. Fatigue becomes constant, not normal tiredness. Deep exhaustion after simple tasks like getting dressed or walking to the mailbox. That's because your muscles aren't receiving enough oxygen-rich blood. A persistent cough or wheezing can appear, especially at night. Many people are treated for asthma or bronchitis when the real problem is fluid in the lungs. Shortness of breath often worsens when lying flat. You prop yourself up on pillows. You wake up gasping and have to sit upright to breathe. This happens because fluid shifts into your lungs when you recline. Then comes unexplained weight gain, 2 or 3 pounds overnight, 5 pounds in a week. That's not fat. That's fluid retention. Your body is holding water because your heart can't circulate it properly. Swelling follows. Ankles, feet, lower legs, shoes feel tighter by afternoon. Socks leave deep impressions. Press your finger into your ankle and the dent stays. Blood is backing up in your veins. And finally, the most overlooked sign of all, waking multiple times at night to urinate, not once, 3, 4, even 5 times. During the day, fluid pools in your legs. At night, when you lie down, it re-enters circulation. Your kidneys rush to remove it. This is not normal aging. This is your body struggling to manage fluid because your heart isn't doing its job efficiently. These symptoms don't appear overnight. They creep in slowly, and because each one feels small on its own, people fail to connect the dots. That's how early heart failure hides in plain sight. Let me share another story. Thomas was 68. He had high blood pressure for years but rarely took his medication. His legs swelled. He blamed sitting too much. He got winded climbing stairs, blamed being out of shape. He gained 10 pounds in 3 weeks, blamed holiday food. When he finally sought help, his heart's pumping strength had dropped to 30%. Normal is above 55. His heart was severely weakened. Treatment helped, but much of the damage could have been prevented. This is why timing matters. Heart failure responds best when caught early. And here's something most people don't realize. You don't need dramatic symptoms to have serious heart damage. Your body adapts until it can't. Then decline accelerates quickly. That's why recognizing patterns early changes everything. So what do you do if any of this sounds familiar? First, don't minimize your symptoms. Don't tell yourself you're probably fine. Make an appointment and clearly describe what you've noticed. Fatigue, swelling, breathlessness, nighttime urination. Ask for proper evaluation. There's a simple blood test that measures a hormone released when your heart is under stress. There's a painless ultrasound that shows how well your heart pumps. These tests provide clarity. If heart failure is diagnosed, understand this. It usually cannot be cured, but it can absolutely be managed. Progression can slow. Symptoms can improve. Quality of life can be preserved. Sometimes heart function even recovers. Medication plays a major role. Certain drugs reduce strain on the heart, others remove excess fluid, some protect heart muscle. Newer therapies dramatically improve outcomes, but medication alone isn't enough. Lifestyle choices matter deeply. Reducing sodium is critical. Salt causes fluid retention. Less salt means less swelling and easier breathing. Monitoring fluid intake helps prevent overload. Gentle daily walking strengthens circulation and preserves muscle. Tracking your weight every morning alerts you to fluid buildup before you feel sick. Small actions done consistently give your heart breathing room. Barbara learned this the hard way. She was faithfully taking her medications but eating frozen dinners every night. Each meal contained more salt than her heart could handle. Once she switched to fresh, low-sodium meals, her swelling decreased within weeks. Her breathing improved. Her energy returned. Medication works better when you remove obstacles. Heart failure doesn't exist in isolation. It's connected to blood pressure, kidneys, lungs, sleep quality, and metabolism. Managing it means caring for your whole body. I want to address something emotional now. Many people feel defeated when they hear the words heart failure. They assume decline is inevitable, that their active life is over. That's simply not true. Modern treatment has changed the outlook dramatically. People diagnosed early and treated properly often live full, meaningful lives for many years. Robert came in at 66 with reduced heart function. He thought everything he loved was behind him. With proper treatment, lifestyle changes, and consistency, his heart strength improved. He returned to activities he thought he'd lost forever. That improvement happened because he acted early. And that's the message I want you to carry with you today. These symptoms are not death sentences. They are invitations. Invitations to listen, to respond, to protect your future. So if you've been feeling unusually tired, if your legs swell by evening, if your shoes feel tighter, if you wake multiple times at night, if climbing stairs leaves you breathless, please don't brush it off. Your body is asking for attention, and you deserve to give it. Heart health isn't about perfection. It's about awareness. It's about taking small steps before small problems become big ones. It's about honoring what your body is telling you, because your heart has carried you through every moment of your life. Now it may be asking for a little care in return. Thank you for spending this time with me. If this message helped you understand your body better, stay with Health Wellness Secrets. We're here to guide you gently, honestly, and with compassion. And remember, noticing early signs today can protect your tomorrows.